Imagine having numbness in your hands and feet, difficulty walking, and memory problems, and the only thing your body is missing is a vitamin. Okay, so, hi everyone. I'm a fourth year medical student and I teach one concept at a time. Follow me on Instagram and subscribe to my channel if you haven't already. Let's study together. Right, so today we're discussing vitamin B12 deficiency anemia, which is a type of megaloblastic or macrocytic anemia because red blood cells become larger in size than normal. To understand vitamin B12 deficiency anemia, you have to first understand the role of vitamin B12. So it has two jobs. Simply, number one is DNA synthesis, and number two is myelin synthesis. Myelin is the protective covering around your nerves, right? Talking about the impaired DNA synthesis first, when there is a deficiency of vitamin B12, methionine synthase is not able to convert homocysteine into methionine because vitamin B12 is required as a cofactor for methionine synthase, right? So it decreases and homocysteine accumulates, and that leads to impaired DNA synthesis. Similarly, when vitamin B12 is deficient, methyl malonyl CoA mutase cannot function properly and methyl malonic acid accumulates, and that leads to impaired myelin synthesis. Moving on to the causes, pernicious anemia is one of the most common causes of vitamin B12 deficiency anemia, and that's because it is an autoimmune condition in which your body makes antibodies against the intrinsic factor. Now, intrinsic factor is essential for the absorption of vitamin B12 in the terminal idiom, right? No intrinsic factor means no vitamin B12 absorption. Other causes can be malabsorption due to diseases like celiac disease, Crohn's disease, or inflammatory bowel disease, and then strict vegan diet or long-term use of drugs like proton pump inhibitors because they interfere with absorption, or an infection due to fish tapeworm Diphyllobothrium latum, which is basically the vitamin B12 consuming parasite in the gut. The signs and symptoms of vitamin B12 deficiency anemia are some classic anemia symptoms like fatigue, weakness, paleness, because obviously there is low hemoglobin, so low oxygen reaching your tissues, and some more specific symptoms of megaloblastic anemia like leucitis, which is characterized by beefy red tongue and some memory problems, ataxia, difficulty walking, and numbness in the hands and feet. The neurological features of vitamin B12 deficiency anemia, for example, subacute combined degeneration of spinal cord, peripheral neuropathy, cognitive decline, and psychiatric symptoms like depression, irritability, and psychosis, is what basically differentiates it from the folate deficiency anemia, because even though both are macrocytic anemias, but the neurological signs and symptoms are only specific for vitamin B12 deficiency anemia. This can be an important exam question, by the way, which is differentiating the two types of anemias. The sources of vitamin B12 are animal products, normally like meat, eggs, milk, cheese, and body has a good amount of vitamin B12 stored, almost 3 to 5 milligrams, so its deficiency develops very slowly. So treatment depends upon the cause. If it is due to pernicious anemia or malabsorption, parenteral vitamin B12 injections are given in the form of hydroxycobalamin or cyanocobalamin. But if it is due to a dietary deficiency, then high dose oral vitamin B12 is sufficient in some cases. Alright, guys, that's it for vitamin B12 deficiency anemia. Thank you for listening and take care of yourself. Study well.